There are 7 critical blood tests that everyone should get to significantly improve their health, and this really hit home for me last week when I saw a new patient at the clinic in his mid-50s who was fit and healthy, but a month earlier had suffered a heart attack that was entirely preventable if he had got these tests earlier. And later in the video, we'll tackle a fascinating question. If we were multimillionaires, why shouldn't we just get every test possible? So the first test that I wish my new patient had got much earlier in life is lipoprotein a. Lipoproteins are vehicles that carry cholesterol around the body, but lipoprotein a in particular is strongly associated with heart attacks and all-cause death rates. Lipoprotein a levels are primarily driven by our genetics, and lifestyle has minimal impact on them. So many clinical guidelines now recommend to test lipoprotein a at least once in a person's life, and ideally we want levels below 30 milligrams per deciliter. A lot of people will have levels in that safe zone, but unfortunately for my new patient that I saw at the clinic, their level, which they only found out about after they had their heart attack, was 68. Testing for lipoprotein a is crucial because if it's high, we absolutely need to do everything that we can to control our other heart attack risk factors. So we need to make sure that we're having a great diet, such as the Mediterranean diet, we're regularly exercising, no smoking, little or no alcohol, managing stress, and then tightly controlling our other cholesterol levels, which brings us onto the second blood test that we absolutely need to do, which is a general cholesterol blood panel. The standard panel includes total cholesterol, HDL cholesterol, LDL cholesterol, and triglycerides. There's a lot of confusion online about blood cholesterol levels, so let's try and tidy that up. First of all, cholesterol is essential for life and we cannot live without it. It's important for our cell membranes, to create hormones such as testosterone, bile production so that we can digest fats, and the list goes on, so no cholesterol equals no life. But we've known for decades that every cell in our body can produce its own cholesterol, but every now and again, some cells need a temporary top-up, so that's why organs such as the liver can produce extra cholesterol and transport that around the body. But to transport the cholesterol, we need to package it into a vehicle called a lipoprotein. And that's what we measure on the blood tests. So we're only measuring a tiny fraction of the body's total cholesterol levels, because again, we're only measuring the blood cholesterol levels. And we measure these levels, particularly the LDL cholesterol, because if those levels are too high, then the cholesterol can be dumped into our blood vessel walls, blocking them, and that leads to heart attacks and strokes. This is why the 2019 European Society of Cardiology recommends that LDL cholesterol levels should be lowered as much as possible to prevent cardiovascular disease. A few things to note here. Online, you'll see a lot of health influencers talking about oxidized LDL or small dense LDL because they claim that those are the true culprits of blockages of our blood vessels. That is incorrect. As a broad simplification, the cholesterol vehicles or lipoproteins have either got an ApoA tag or an ApoB tag, and it's the entire ApoB family, including all types of LDL cholesterol, IDL, VDL, that contribute to blockages of our blood vessels, because that entire ApoB family can freely flux across our blood vessel walls where they can become retained. So if you wanted to consider paying for extra blood tests, consider ApoB because it offers a clearer picture for our cholesterol levels. Although that generally doubles the costs, which is why most clinical guidelines rely on LDL cholesterol levels rather than ApoB. The next thing that comes up online is what evidence do we really have that lowering LDL cholesterol reduces heart attacks? Well, in a meta-analysis of 34 randomized clinical trials involving over 270,000 participants, they found that as we lower LDL cholesterol levels, it progressively reduces total death rates and heart attacks. The final point of confusion is that some people worry that we can lower our blood cholesterol levels too much. But remember, every cell in our body can produce its own cholesterol levels, and the cholesterol content that we measure in the blood, it only represents a tiny fraction of the body's total content. So when we have a look at human clinical studies looking at very low LDL cholesterol levels, they are not associated with any adverse events. So what ranges are we looking for? Well, it does depend on your individual risk factors, but as a broad simplification, if you've already had a heart attack, then we want to try and drop our LDL cholesterol levels and ApoB as low as possible. We do this via a combination of diet, exercise, and cholesterol-lowering medications such as statins, ezetimibe, and PCSK9 inhibitors. On the point of statin side effects, because this always comes up in the YouTube comments, statins cause a very small increase in mild muscle muscle pain that affects about 1 to 2 patients per 100. Statins are not associated with cognitive impairment, nor do they affect testosterone levels. Now, if you don't have any other risk factors for heart attacks, such as high blood pressure or diabetes or a strong family history, then a reasonable target is to get your LDL cholesterol below 70. Personally, I target a level lower than that, so I want my LDL cholesterol to be below 50 because I want to do everything that I can to prevent a heart attack when I reach 70 or 80 years old. To do this, alongside a great diet and exercise, I take rosuvastatin 5 mg. And coming back to my new patient who I saw at the clinic, when they tested his cholesterol levels at the hospital, his LDL cholesterol was 172. So if he'd known about his high lipoprotein a and high LDL cholesterol levels and done something about it earlier in life, his heart attack could have been entirely prevented. Speaking of heart attack risk factors, the next blood test that's absolutely essential is HbA1c. This is a marker for diabetes and it shows your average blood sugar levels over the past 2 to 3 months. Obviously, we want to be in the normal range. Now online you might see some people promoting insulin blood tests, or for non-diabetic patients to pay for continuous glucose monitors. It's your money, your call, but as a primary care physician, those tests, they don't particularly interest me. It's the HbA1c that really matters, and is what the preventative care clinical guidelines are based upon. The next tests are sodium, potassium, and creatinine. These are fantastic screening tools to make sure that our kidneys are working correctly. And the final blood test is to get a full blood count. This checks our red blood cells, so we're screening for things like anemia. It also checks our white cells, and if any problems are noted on this test, then it's a signal to primary care physicians such as myself that it needs further investigation to make sure that there's no underlying issues. So in terms of blood tests that everyone should get, that's it. And so long as there are no abnormalities that have been noted on those tests, then for people aged between 18 and 35, they only need to have done those tests at least once, and for people over 35, we need to do those tests at least every 5 years, excluding lipoprotein a, of course, which we only need to do once in a person's life. There are many other blood tests which are done for specific reasons, and we'll come to those later in the video, but for now I want to answer a fascinating question that one of my patients asked me yesterday. This question is often brushed off as simplistic because it seems to have an obvious answer, but when you delve a little bit deeper, it's actually quite thought-provoking, and the question is this: if we're unsure about a patient's diagnosis, why don't we just run every single test possible? You might think that the straightforward answer is cost and impracticality, but the patient who I saw yesterday was a multi-millionaire and he could easily afford these tests. So he asked hypothetically if he was willing to foot the bill for every conceivable medical test, why not just conduct them all? And it got me thinking. The truth is, no medical test is perfect. Each has a rate of false positives and false negatives. So a false positive means that the test indicates that a patient has the disease when they don't, and a false negative, on the other hand, suggests that a patient is disease-free when they're not. Let's consider a hypothetical disease and call it terrible-itis. Now say it affects 1 in 1,000 people and our test has got a false positive rate of 1 in 1,000. So if I were to test the next 1,000 patients walking through my clinic doors, we would statistically get 1 false positive, but we'd also expect 1 actual sufferer among these 1,000 people. So if I got a positive result, there's a 50-50 chance that it's wrong, and that's rubbish. Now imagine if terrible-itis affects 1 in 10,000 people. If I test the next 10,000 people with a test that has a false positive rate of 1 in 1,000, for every 10 positive results, 9 would be incorrect. That's clearly completely useless, and we haven't even factored in the false negative results. This illustrates why pre-test probability is so important in medicine. We need to narrow down which tests to run for each patient, and we do this by using the tried and tested methods of talking to our patients and examining them. So if your doctor doesn't want to run a particular test, it's not necessarily about saving money, it's about having a reasonable suspicion that you may have a specific diagnosis before running that test. This allows us to interpret the results correctly, and remember that some tests, they do come with risks. For example, radiation from a CT scan. So if we start running these tests on every patient, those risks quickly accumulate. Coming back to other blood tests that may be done in addition to the 7 that we've already gone through, let's have a look at liver function tests. As I mentioned, I take a statin, so I get my liver function tested once a year. And other people who need their liver tested include people who drink alcohol, who are overweight, who are on other medications, etc. But for otherwise healthy people who are not on any medications, the guidelines do not suggest routinely checking the liver function because there's no added benefit. It's a similar story for things like thyroid function. So of course, if a patient comes to me who are fatigued, or who may have thinning of the hair, or are gaining weight, then of course we would test the thyroid function. But for otherwise healthy people with no symptoms, the preventative care clinical guidelines do not suggest routinely testing thyroid function, because once again, there's no added benefit. It's exactly the same story for inflammation blood tests, such as high sensitivity CRP. These do not change our clinical practice. And I can feel people getting quite cross with me in the comment section, so I'm going to say this: it's your health, your money, your decision. If you want to pay for extra tests, that's absolutely up to you. I'm just mentioning the clinical guidelines for preventative care and highlighting the blood tests that really make a difference for your health. The same can be said for micronutrient tests, such as vitamin D. Of course you can pay for these tests, but for the vast majority of patients, it doesn't change what we do. We know we need to have a great diet, and if you're taking a low-dose multivitamin and mineral, such as microvitamin, you know that your micronutrient levels are going to be absolutely fine without having to pay for a test. But of course, if you've got a medical condition such as fat malabsorption, then yes, we need the micronutrient tests. But for otherwise healthy people who we are screening, we don't need to do these tests. Please let me know in the comment section what you thought about this video and what blood tests you get. And make sure to check out this next video here on the best diet that we know of from the current available research.